Chikamo Gina Longu ni Dr. Jacques Corey Cormier, Nina Furaha Kukutona Nawewe. Hello, I'm Dr. Jacques Corey Cormier, and I'm going to go over some of the basics of first aid with you. I'm going to cover how to administer CPR and the steps of first aid during an emergency. Now, CPR came into popularity around the 1970s with its first use in a training video called The Pulse of Life. CPR stands for cardiopulmonary resuscitation, and you use it when someone stops breathing or their heartbeat stops. It's a useful life-saving technique that starts with chest compressions, and the biggest part about it is that it's better than doing nothing. Seeing someone who is no longer breathing or they no longer have a pulse, performing CPR on them could be helpful, and the meaning between life and death and waiting for the proper medical professionals to arrive to the scene. So before we even get into the chest compressions and the things that you see on TV when people start doing CPR, we have to prepare ourselves for the process to begin with. So I'm going to go over the pre-CPR steps and then CPR itself. So first, before we start pumping onto someone's chest, we want to make sure that the scene is safe. Is it in the middle of a burning fire, burning building? Is it flooding? Is it safe to lay this person down? Or do we need to move them to a safer place before we even begin? Similar to the Michael Jackson Smooth Criminal song, you want to ask the person, are they okay? So before you even begin beating on their chest, you want to make sure that they're not just sleeping or, just maybe have a light breath going on during their deep slumber. Nudge them a little bit, see if they are responsive or not. And then you want to go through some steps. So once you realize this person is non-responsive, you want to delegate responsibilities to the people around you, i.e. other bystanders. When someone stops breathing or someone might have just drowned and you recovered them from the water, you want to get people who are standing around involved. You don't want to be the only person attempting to save a life. So you point to people and say, hey, you, call 911. You, get me an AED. An AED is an automated external defibrillator, and is used to monitor and establish one's heartbeat. Now, what's important about making sure that you make eye contact and you point at people and tell them what to do is to get around something called the bystander effect. Basically, the bystander effect is when there's a lot of people around, responsibility is diffused. So you have to if you just yell out loud, someone call 911, everyone's going to think it's someone else's responsibility to do it. So just make sure that you're pointing at people and that you're being very deliberate with, hey, you with your phone out, call 911. You standing around looking, go see if there's an AED in this building or in the vicinity. Most important is that you stay with the victim. If you're going to be here to help save their life until the proper medical professionals show up, you don't want to just leave them. Even from a psychological standpoint, might get their anxiety going, or you don't want people just laying on the ground by themselves unattended. You never know, they might start convulsing or other things that they would need you to be there to at least witness and to deal with. So make sure that you stay with the victim. Don't say, I'm going to come back with more help. It's better for you to deal with them yourself than to abandon them. So when they're on their back, you want to lay them down flat on a relatively hard surface. You want to tilt their head back and lift their chin. This is going to open the airway and get you ready for the next step. After you tilt their head back, open up the airway, you want to look down the length of the person's body and see if their chest is rising. Put your finger on their nose, see if there's any sort of breathing. Check this for no more than 10 seconds, and if you get no response from that, go ahead and start the chest compressions. Now, what you want to do is, I usually learn the dominant hand's what's going to actually be the one pushing on the chest, while your less dominant hand is behind it. You're just going to use that as a nice grip, as you see in the image before you, and push down onto that chest about 2 inches deep. You're going to push hard and fast. But how fast? about 100 beats per minute. And so think of Beyonce's Crazy in Love song, or think about the Bee Gees' Staying Alive song when you're giving people chest compressions. So you give them chest compressions, lift that head up, tilt it back, pinch that nose, and seal your mouth over the victim's mouth so that you can begin to deliver rescue breaths. Blow into this person's mouth to make the chest rise. You should be able to see it. That's how you know when you have a complete seal over their mouth and that you are actually giving more air to their lungs and just breathing into their actual mouth area. Give about 2 breaths and then continue back with the chest compressions. And rinse and repeat. You continue these chest compressions, do it for 30 seconds to a minute, and then back to giving rescue breaths. So in review, first you want to survey the scene, make sure that you call the proper medical professionals so they're on their way while you're attending to this person. Lift their chin to check for breathing, give those rescue breaths, perform the chest compressions, and rinse and repeat with those breaths and compressions until the proper medical personnel shows up. Now, so that was CPR, but in general, whenever there's an emergency, emergencies range from buildings on fire, wildfires outside, car accidents, motor vehicle injuries, and, some more self-inflicted of maybe someone's passing out from intoxication, or maybe someone just slipped on a banana peel, bumped their head, and now they're non-responsive. So the first thing you want to do is freak out, right? No, just kidding. You don't want to freak out because you, as the person that's going to be responsible for this responsive or non-responsive individual, you need to make sure you stay calm and do the similar steps that we've done with CPR we're about to go over again. You want to survey the scene in any emergency situation. Is there flooding going on? Is there a gas leak? Is there fire? Is there potential for more harm to be caused to you and this person? You also want to check the victim themselves. Are they bleeding? Are they been shot, stabbed? Is their eyes rolling to the back of their head? Are they able to breathe on their own, etc.? So just basically checking the person out and checking your scenery out. Is it safe? And also make sure, again, that we want to get bystanders involved too. This is not solely your responsibility to potentially save this person's life. Everyone who is around when this person passes out, this person falls and hits their head, or you round the corner and then that person's just laying there, try to get other people involved as well, because you don't want just people being bystanders, especially today where all some people want to do is just record something. Make them get involved. Tell them stop recording, call 911 or to help out. So let's say the person is responsive. Maybe they've had too much to drink. Maybe they're feeling lightheaded from not taking their medication or low blood sugar. If the person is actually able to respond to you, you want to make sure you get consent to give care. You don't want to just start giving chest compressions or start moving people without getting their permission to help. Okay. Again, we're going to point to our bystanders. Hey, call 911. You get me an AED, depending on the situation. And you want to begin to ask the person. Again, if they're responsive, you should be able to have some sort of conversation with them. Sir, ma'am, do you have any allergies? Have you been drinking? Do you feel any pain? What's the last thing you remember? Hey, are you understanding what I'm saying? You just want to get a sense of the situation from the person's perspective. They might tell you, hey, my blood sugar is low. They might not be able to be coherent in their words, slurred speech and things like that. You want to just pick up on it. Might be a stroke, might be signs of a heart attack. It might be, again, people being drunk or under the influence of substances. Of course, in perfect world, if you could have gloves or some way to clean your hands, sanitize your hands, you want to do that to make sure that, if they're bleeding or have some sort of cut or you have some sort of cut, you're just not transferring fluids between the two of you. And only do what you are able to do. So don't, if you only know CPR, then just let it be known that this is all that I can do. If you don't know any other techniques, if you don't know CPR, then just be honest with yourself and with the person that you're trying to help. You want to check from head to toe, head, shoulders, knees, toes, and everything in between. They might have a cracked rib, a broken arm. They might have something lodged into their body and not know it because they're laying on it. So you just want to be really gentle when you're checking them from head to toe. Again, laying their body flat out on a hard surface so that you can check their body for injury. So what if the person's non-responsive? So you've asked, hey, sir, ma'am, can you hear me? You want to tap them. Don't give them a slap like in the movies. You just want to tap them, nudge them, because you're not trying to cause any additional harm to these people. Again, checking these things for less than 10 seconds because every second is going to count, especially if the person is not breathing or if their heart has stopped. And we're always getting people who are around us involved. It's not a one-man show. If the victim is breathing but still non-responsive, we're still going to do our head-to-toe check, starting with our head, checking our arms, shoulders, chest, ribs, hips, and feet. And then you want to roll that person on their side. If they're still breathing, they might have to throw up, or just want to make sure that they're not going to choke on themselves. If the person is non-responsive and not breathing, then we want to go back to our CPR techniques, okay? Giving us the 100 beats per minute and breathing, giving people rescue breaths, 2 of them, and getting back to the chest compressions. So if someone is in need of emergency, if they're responsive, then you ask questions, get consent before trying to administer help. If they're non-responsive, then they can't give consent, but you're trying to be a good Samaritan, so go ahead and start CPR. See if you can get them breathing again or their heartbeat going regularly. Okay. I'd like to thank you for your time today learning about how to administer CPR and what to do regarding first aid and emergencies. Thank you.